Good day everyone. Our group was tasked to put together a role play on different therapeutic communication techniques for us to use in approaching different types of patients. First, let me introduce our group members and our roles. Sharra Mae Moreno as scriptwriter, Therese Samoro as editor, Princess Tumangday as patient, Mikaila Theresa Montinola as nurse, and Gean Louise Moleta as our narrator. So now let me show you our compiled role play. Sit back, relax, watch, and learn.
One of the therapeutic communication techniques that a nurse should know is how to apply offering oneself. For the first scenario, we have a patient who is lonely and stressed because a few days have passed since someone has visited her. Here, we would be able to see how a nurse would apply this therapeutic communication of offering oneself.
Hi, Ma'am Sharra. How are you feeling today? Did you have your lunch?
Hi, nurse. I'm fine. A bit lonely because it's been days since someone visited me. I'm just about to eat my lunch.
Is that so? If you'd like, I can stay with you for lunch.
Sure, that would be nice. I have received the message that my sister's going to visit me.
That's nice. I'll stay with you until your sister arrives. We can just sit here quietly for a while. We don't need to talk unless you would like to.
Thank you. That is very considerate of you.
In the scenario previously shown, we saw how the nurse suggested her presence, interest, or wish to understand the patient without making any demands or attaching conditions that the patient must comply to receive the nurse's attention.
Ma'am, please, you need to eat your food. It's getting cold now.
No, I won't, unless I'm out.
But you're not strong enough yet to be outside this hospital.
I am, and I'm sure of it.
Ma'am, please eat this meal and it will help you recover. And in that case, you're free to go out.
Is that so hard to understand? That I won't eat unless I'm out?
You know, ma'am, your parents want the best for you. They're doing this because they want you to recover. And if you keep on insisting on not eating your food, then just accept the fact that you'll be staying here for a few more days. Ma'am, I'll leave your food here. I'll be back after 2 hours. Take care, ma'am.
After the nurse left, the girl was thinking of what the nurse had said. She realized that following her parents wasn't that bad. It's for her own good. So, she ate her food. After 2 hours,
Wow, ma'am, you ate your food. That's a good start for recovery.
Just doing what's best for me.
That's very good, ma'am. It's nice seeing you smile. You should smile often. It suits you.
Thank you, nurse. It was the very first time. The first time someone complimented me.
My pleasure. Also, it's part of my job, making people smile and helping them recover.
in the scenario previously shown, we saw how the nurse gave recognition in a non-judgmental way towards the change in the behavior of the patient, in the effort the patient has made, and in the contribution of patient towards communication. Finally, a nurse should also be able to apply the therapeutic communication technique of clarifying time or sequence. For this final scenario, we have a new patient who seeks healthcare. Her concern was that she has been vomiting nonstop since last night. In this scenario, we would be able to see how a nurse would apply this therapeutic communication of clarifying time or sequence.
Hello, ma'am. I am Nurse Mikaila and I will be your nurse for today. May I know your name?
Hi, nurse. My name is Sharra.
Hello, Ma'am Sharra. How can I help you today?
Well, I came here today because I had been vomiting since last night and I had a really bad headache and my stomach is throbbing just this morning when I woke up at 6.
Did you start vomiting after your dinner last night? May I know what time you had your dinner and what you ate?
Sure. I started vomiting after I had my dinner yesterday at 7 p.m. Me and my colleagues decided to have our meal at the newly opened seafood restaurant where I ate a lot of shellfish.
Are you allergic to shellfish?
Well, actually, I don't have any food allergy at all.
Did you start vomiting instantly after you finish your meal or after a few minutes?
No, actually, I started vomiting 3 hours after my meal.
I see. How long did it last?
Well, I stopped vomiting at midnight and I think it exactly lasted for 2 hours.
Are there any other symptoms present last night when you were vomiting, such as abdominal pain, fever, diarrhea, or headaches?
Well, I also experienced abdominal pain and a headache last night, but it wasn't as bad as this morning when I woke up.
I see. Did you experience abdominal pain before, during, or after vomiting?
It was actually while I was vomiting when I first experienced abdominal cramps and it subsided after I finished vomiting. However, when I woke up, it came back and it was worse than the last night.
How about your headache? Did you also experience headache last night?
No, it was just nausea after vomiting.
So your headache started this morning when you woke up?
Yes, a really bad one.
Did you vomit any blood?
No, there was no blood.
Did you vomit anything that looks like coffee grounds?
No, it was mostly what I ate last night. I mostly vomited undigested food.
Did you take any medicine last night? If so, what medicine did you take?
Yes, I drink Pepto-Bismol because it was getting late at night and I was still vomiting.
Okay, so as I understand, please correct me if I'm wrong. You had dinner at 7 p.m. with your colleagues at a newly opened seafood restaurant where you ate a lot of shellfish. Then, after 3 hours, when you went home, you felt nauseous and started vomiting. While vomiting, you also started feeling abdominal cramps. After you drank Pepto-Bismol, you stopped vomiting at midnight. However, when you woke up this morning at 6 a.m., you experienced another abdominal cramp, which was worse than last night, accompanied by a bad headache. Is this correct, ma'am?
Yes, exactly.
Did other people at the same place have the same symptoms?
Well, I called my colleagues this morning and it seems like I was the only one who experienced discomfort last night.
I see. Well, let me get you a glass of water and an IV fluid to prevent you from getting dehydrated. You were probably dehydrated from vomiting last night, hence, you've had a severe headache this morning.
Okay, nurse, thank you.
As what the scenario have shown, we saw how the nurse helped the client clarifying the events that experienced last night in relation to time.